Now we move from Southeast Asia to South America, and we have Dario from Argentina.
Hello to everybody. We founded ArSAM 2 years ago with colleagues from all over the country, specialists in addiction, with whom we have been working for more than 20 years. Some of them founding members of ArSAM. In addition, our association has the representation of the South American region of ArSAM. We want to stimulate of young professionals in ArSAM. That is our aim. And for more information, you can check our website. The current situation is as a priority to make ArSAM known in the country and in the region, encourage the participation of colleagues in ArSAM, establish a regional network. And as a challenge of ArSAM right now, in this moment, is reduce language and cultural barriers to interact with you all friends and colleagues from all over the world, and as needs, establish a realistic plan to engage more professional in ArSAM's activities. And we expect from ArSAM support to have ArSAM speakers, Spanish speakers in local activities, and we do have that support, and make ArSAM's educational tools more accessible, and scholarships and internships opportunities for young professionals. And we can contribute with the aim of ArSAM, making ArSAM known at regional events and stimulate the involvement of young professionals, contacts with reference of the region, and sharing information, local experiences and data. Finally, we are organizing a regional ArSAM meeting in Córdoba, Argentina, in which it will be held on August 25th and 26th this year. We will soon have the website and more information. Unfortunately, the other colleagues from Uruguay, Chile, and Peru cannot connect it because the problem of the amount of participants, but we are working all together to be part of ArSAM. Thank you very much for this opportunity.
Thank you. Thank you very much, Dario. Thank you very much. And we have Gabriel. Gabriel, could you hear us?
Good morning, good evening. I'm Gabriel from ABEAD, Brazilian Association of Studies of Alcohol and Other Drugs. We are, next slide, please. We are an association around 600 members nowadays. We are obviously always wanting to expand. We have in our associates doctors, psychologists, social workers, law workers, and we are not only a health association, but any field associated with the drug issue, we are accepting members. And we try to work in advocacy, in expanding knowledge, and trying to diminish the stigma of the drug problem and the addiction. And we've been doing that a lot through social media. We have a very good experience in reaching out, in expanding our reach through social media. So that's one thing. Next slide, please. That we can contribute with ArSAM, put our experts available also, bring the Brazilian experience that it's somewhat a little bit particular in the world. Brazil has a lot of specifics in its policies that can be very helpful for other places, and we would like to have always a better exchange of scientific knowledge on this issue, and opportunities of internships, also receiving them and putting our members, offering our members that experience. So thank you very much.
Thank you very much. And now we have Carmen from Chile. I'm not sure if Carmen is with us right now. So Carmen is not with us, but But Dario is, Dario is leading that part of the world. He is the regional representative of South America. Hopefully, we will have colleagues from South America being really active in the ArSAM community. And then we have Alicia. It seems that Alicia has not been able to join us as well from Peru. And we have already shared the slides with those who have access to the chat space. So you can find the slides, you can find bio sketches, you can find details about the organizations in the bio sketch. And now we have Ayana and Ronald from Barbados.
Thanks, Hamid. So it's actually great to have this opportunity, I think, to be here and briefly introduce our region and share some of the challenges that we face in mental health and addiction medicine, and also hear from others about solutions and possibilities for collaboration. So I'm a clinical and academic psychiatrist and just recently returned to Barbados after a couple of decades in the UK. And I guess the first thing to say about the organization that I'm representing, the Barbados and Caribbean Society of Addiction Medicine, is still very much a vision and work in progress. And so I was actually due to be joined by my colleague, Dr. Ronald Chase, to represent the Barbados Association of Psychiatrists, which we hope can serve as a springboard for leadership in addiction medicine in the region. But he was unfortunately also unable to get in. So then just briefly to comment on the BAP, it was originally formed in 1994 and lapsed after about 20 years. But COVID and the pandemic really provided the impetus to reconvene just over a year ago. And there are 30 member psychiatrists, generalists, and subspecialists in substance use, forensic, and child and adolescent. And that is pretty much the full complement of psychiatrists on the island. So in terms of just giving a brief overview of the current situation for the region, and I think then if we go on to the next slide, and we're talking about the English-speaking Caribbean, which is the gray highlighted countries. And one of the major challenges is access to mental health and substance use services, which is variable nationally and regionally. And if you take, for example, Guyana, which is actually in South America, where 75% of the population live in rural areas and account for a significant proportion of the mental health and substance use burden, whereas the mental health services and professionals, to the extent that they exist, are concentrated in urban areas in and around the capital. And then if you take, for example, Barbados, with its 30 psychiatrists, it has roughly 10 times more psychiatrists per capita than Guyana. So one of the key challenges is around how to optimize the use of the existing human resources and capabilities across the region, in addition to developing further technical expertise. And this really requires better data capture, including epidemiology, service provision, and outcomes data that can be really used effectively to support regional leadership and policy development. So in terms of the opportunities with ArSAM, these are certainly at the individual technical capacity and expertise level, access to training and educational resources, as well as support in developing research capacity and evidence-based reforms through initiatives actually like the Global Experts Network. And the opportunity like this to communicate and collaborate internationally with colleagues that face similar challenges. And that's, I think, also where we have the potential to contribute. And of course, we're also very happy to host an ArSAM annual meeting. And I wish I'd finished with a slide with a photo of the beach, but I haven't, but you can imagine. Thank you.